Maybe you noticed pimples on buttocks or thighs. It's a very common condition and it is called folliculitis. What means folliculitis? It means inflammation of hair follicles. You can think of it about small channel in the skin which is clogged and which is inflamed, and pus is formed, and we see it as a pimples or pustules, and it is called folliculitis. Folliculitis is inflammation of hair follicle. What people see and what people feel when they have folliculitis. These small pimples are usually with white tip, which looks like acne also, but it's different. Usually it's bacterial infection, and most common bacteria which is responsible on this infection is Staphylococcus aureus. It is very common bacteria on our skin, and usually it occurs in healthy people, healthy young people. These pimples are inflamed and swollen and red and uncomfortable. Sometimes they are painful. They can be shallow or they can be deep nodules. So they can have different forms and different visual also. Usually they are pus-filled pimples resembling acne. What are the risk factors for folliculitis? Usually there is no important risk factors because it affects generally healthy young people, but it's common also in people with diabetes, immunosuppressed people who intake immunosuppression therapy. Genetics is important. If parents have this folliculitis, children tend to have folliculitis also, and hygiene is also important. Why it's important? Because warm and wet environment causes this bacterial grow, and if person is sweating and don't shower after sweating, there is higher risk of folliculitis. Also, if person wears tight clothes, it's also risk factor for folliculitis. If person don't use antibacterial soap, it increase risk of folliculitis. If person shares towels and razors, and after shaving, for example, it's very common. After shaving, these pimples are very common. Folliculitis is very common, and especially if there is shared razors, this risk is increased. Folliculitis is not transmitted like, for example, flu or chickenpox. It's not like this. It's not such contagious disease, and it's not considered as contagious disease officially. But sharing towels, sharing razors, and sharing personal things increase risk of folliculitis. What is treatment? Treatment is using regularly antibacterial soap. It's important. Warm compresses also sometimes help, and reduced hydrocortisone cream reduces swelling also and reduces inflammation. Mupirocin and clindamycin are antibiotics which are effective. Mupirocin and antibiotic creams are used usually 2 to 3 times per day for several days, and usually it's the effective treatment of mild folliculitis. Antibacterial creams are used several times per day, and regular shower also important, and drying skin is important also. In severe cases, oral antibiotics are used like cephalexin and doxycycline. These antibiotics are important in case of severe folliculitis. And what is prevention? Idea of prevention is Avoid warm and wet environment. Avoid tight clothes. Use clean razors. Use antibacterial soap after shaving. It's important. Laser hair removal instead of shaving is also important. And shower after sweating is important also. Shower after sweating. Prognosis usually is good. Prognosis is good. In this case, it's bacterial infection. We should remember it. And important is that it's inflammation of hair follicle, and it's a very common condition. And if person has folliculitis, it does not always mean that it's a matter of hygiene. More common cases is matter of genetics. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.